introduction and some discussion of how pharmacokinetics and pharmacodynamics can change as we age, and specifically in our, what I like to say, chronologically gifted patients, our patients with that are as they age, how their pharmacokinetics and pharmacodynamics change and how we should respond as pharmacists. Let's go. All right. So I'm not going to read all these to you, but here are the objectives, and you might look at this for any quizzes or exams to understand what I'd like you to walk away being able to do. So this first section, we're going to just talk quickly about what is aging. So what is it? I guess we all know because we're all doing it, aren't we? And what are the pharmacokinetic changes with aging? What are the pharmacodynamic changes that come along with aging? And then I'm going to go over a few drug class pearls, so some specific things for specific drug classes. And I'm sure Dr. Mosler and others will be focusing on these during the course as well, and what references you might want to use to help make decisions on, particularly dosing or use of particular agents. Then we'll go over a couple of cases. All right, so this is depressing, everybody, especially to somebody like me that's well along on this x-axis here. But you can see after the age of 30, how you start losing all this organ function. So once you're 30, you've reached the peak and things start to go downhill. You probably already knew that. Maybe you didn't think it was 30, but as you age, you lose cardiac index, your GFR goes down, your vital capacity of your lungs go down, your renal plasma flow decreases, your maximum breathing capacity decreases. So all this stuff starts to plummet. But really, what is age? Well, there's lots of ways to measure. As you know, there's some people that are 90 that are out running, 5Ks. And there's some people that are in their 40s that can't do much, So the chronological age is the number of years you've lived. That's how many birthdays you've had, right? So your chronological age is probably not that helpful in determining where you are on that cascade as far as organ function and some kinetics and dynamics changes. But it is one measure, and it's probably the easiest thing to measure because we all know how old we are. But it isn't as predictive as other ways of measuring aging. We also have your physiologic age. So your physiologic age is measuring your organ and biologic function, not just the number of years you've been on the planet. So again, this is more useful, isn't it, as far as determining pharmacokinetics and pharmacodynamics and dosing. Frailty has been talked about a lot in the literature, and frailty is how resilient you are to stressors. So how frail are you? Obviously, the less frail you are, the better as far as aging goes, and being able to withstand the stressors that come along, like COVID, for example, or something that comes along to stress your body. How resilient are you to that? So that's frailty. This seems to be associated with risk of death, basically, which makes sense, right? Multimorbidity, 2 or more chronic conditions put you at greater risk, obviously, for frailty and your physiologic age declining. Functional decline is defined as your loss of independence, which also is an important measure in aging. So age is not just the number of years you've been on the planet, but can be measured in lots of different ways. And we need to be aware of that when evaluating patients. So in summary, chronological age, years lived, is a demographic number. It's not really a good predictor because there's so much variability at the age. It's used only for population norms because it's been easy to measure. Physiologic age, of course, as we said, is organ and biologic function. which is a better clinical biochemical marker, strong predictor of drug response. And we use this for dosing to determine hepatic and renal function, lung function, doing this by what the reserve is left in the body, where they are on that decline, not determined by years, but determined by where they actually are in their function. So this is a better way of determining age. Frailty is the other one that I mentioned, is your ability to your resilience when stressed. This is a functional domain and also is a strong predictor of drug response. Um, when you have somebody that's frail, you want to make sure that you are simplifying the regimen. The more drugs they're on, the more drug interactions they're going to have, the more confusion they might have. They will be more likely to fall, have CNS active drug, avoid CNS active drugs so that you don't have depression, dizziness, things that will put your patient at risk. Multimorbidity, of course, is two or more chronic conditions. It depends on what those two chronic conditions are and how advanced they are. So here's where you get into a lot of drugs often when you're treating a lot of different disease states, where you get a lot of drug interactions, additive adverse effects, etc. Functional decline, loss of independence and activities of daily living. This is also a strong predictor of drug response. So here we want to make sure as they lose their ability to be independent and independently function, you're going to prioritize adherence, simplicity, and maintaining as much quality of life as you can. All right. That's it for that section. I'll be back to talk about pharmacokinetic changes in aging. Thank you.